What is the FRAX tool for osteoporosis risk assessment? Imagine being able to predict your chances of breaking a bone in the next decade. That's what the FRAX tool helps healthcare providers do. It is an online calculator designed to estimate the risk of fractures like those of the hip, spine, forearm, or shoulder over 10 years. This tool combines various clinical risk factors with bone mineral density measurements, especially of the femoral neck, which is part of the thigh bone near the hip. The FRAX tool was developed by the World Health Organization Collaborating Center at the University of Sheffield and was first released in 2008. It uses data from large international studies to identify key factors that influence fracture risk. These include age, sex, body mass index, previous fractures, family history of hip fractures, smoking habits, use of steroids, alcohol consumption, rheumatoid arthritis, and other health conditions that can weaken bones. One of the main advantages of FRAX is that it can calculate fracture risk even if you do not have a bone density test. This makes it especially useful in primary care settings where quick assessments are needed. When a healthcare provider inputs your information, the tool provides a percentage chance of experiencing a fracture within 10 years. For example, if your risk of a hip fracture is 3% or higher, or if your risk of any major osteoporotic fracture is 20% or higher, your doctor might consider treatment options. The FRAX score helps guide decisions about whether to start medications or adopt lifestyle changes to strengthen bones. It is mainly used for people who are 50 years or older, including postmenopausal women and men with low bone density or osteopenia. It complements bone density testing by adding a broader view of your overall fracture risk based on personal health history and lifestyle factors. In summary, the FRAX tool is a trusted, evidence-based way to assess fracture risk. It combines clinical information with bone density data when available, supporting personalized decisions to prevent fractures and maintain bone health. Always remember to discuss your individual risk factors and potential treatment options with a healthcare professional who can interpret your results in the context of your overall health.